This program contains graphic images. Viewer discretion is advised.
A young mother who collapsed in the emergency department while visiting her husband. A well-known physician who never made it back to work. But first, a young woman in the race against time. This is Hartford Med, and they are living miracles.
On the good days, I can do anything.
It is the kind of photo that proves a point. Documenting one woman's experience, the Spartan Race, a challenging obstacle course that takes true grit, something Amanda Lucas has covered.
I ran a Spartan race. I finished it.
I have never been more proud of any of my children than the day she finished that Spartan race. It was so phenomenal.
Ken Roberts is the proud father of Amanda, daughter, wife, mother of two. What you might not know after looking at the mud and the smiles is that her race actually began months prior, Thanksgiving Day, 2013.
Ate dinner at around 2-ish, and then everyone was just hanging out.
Amanda came over and explained to me that her face was getting very stiff. My niece, who's a nurse, she did a quick neurology exam, and she said, why don't you take her to the emergency room? She seems a little weak on her left side. We got ready to leave. And
all of a sudden, something fell off, and my face went numb. Everything went numb and black.
Amanda had a full-blown seizure.
The family dialed 911, and they went straight to Hartford Hospital's emergency department, where the team on call recognized important details that might have been overlooked by a team less skilled. She had a complete workup, including a pregnancy test. It came back negative, but the team was suspicious that her seizures might have something to do with her prior pregnancy.
They did the blood test, which looks at the specific hormone. That came back extremely elevated. So a normal number would be less than, what they say, less than 5, and hers was 80,000.
So what's the link between pregnancy, seizures, and brain tumors? A very rare and rapidly growing cancer called choriocarcinoma. Dr. Aaron Schaefer, a gynecologic cancer specialist with the Hartford Healthcare Cancer Institute at Hartford Hospital, would lead Amanda's care team.
They did a CAT scan of her head and found that she had lesions in her brain, which were metastases from this choriocarcinoma. And then on further workup was found to have pretty much innumerable, so tons of nodules in her lung, which was the bulk of her disease. In a normal pregnancy, part of the placenta has to attach to the uterus, and in some sense it has to invade into the lining of the uterus in order for blood vessels to form and for the developing baby to get nutrients and blood from the mother.
The tissue of her placenta, the tissue that prepared her body to deliver her beautiful baby boy, had become cancerous and had aggressively invaded her body. Tumors were developing and growing in her lungs and her brain.
The seizures that Amanda had when she presented were a result of the metastases to her brain, so the tumors on her brain. Those cells, instead of stopping where they're supposed to stop, on the very surface of the uterus, they can become more invasive. It just becomes so abnormal that it gets into the bloodstream. Choriocarcinoma spreads very rapidly throughout the blood, and that's why where does a lot of the blood go? Well, most of your blood goes to the lungs, the liver, the brain, and that's the main places that this choriocarcinoma can spread to.
In the blink of an eye, 24-year-old Amanda Lucas, mother of two, learned she was in the fight of her life.
6 hours later, we found out that I had cancer all over.
Devastating. It's just, as a father, you want to control everything, and you just have absolutely no control.
There wasn't time to worry. To fight this aggressive cancer, Amanda would have to undergo an even more aggressive treatment.
While we treat a lot of these GTDs or gestational trophoblastic diseases, choriocarcinoma to this extent is really rare. So because of that, we did consult with some experts, outside of Hartford Hospital, people who throughout the country see this a lot more often. And we then conference called with them and with radiation oncology and with medical oncologists. And as I said, the decision then was made to do the whole brain radiation. She also still had all this disease in her lungs and other places. So we started some low dose weekly chemotherapy.
It was a brutal course, but her best shot. The new mother would spend weeks in the hospital, away from her family.
We were going to deal with whatever came, and whatever this brought was just going to be taken a day at a time. Deal with whatever the problem is today, and then tomorrow will take care of itself.
I've always wanted kids at a young age. I wanted to get married at a young age, and now that I have both of those, it's like those are they're my everything. My kids are my everything, my husband, and they just, I don't know, they bring out the better in me. They're keeping me going.
Weeks of radiation would attack the brain tumors.
We started the really intense chemotherapy. That included 5 drugs given 8 days apart, and that cycle repeated itself every 2 weeks.
I'm just so thankful that all of it fell into place. The right people at the right time, and the nurses and everybody at Hartford were just phenomenal.
I'm happy to say that now we're 7 months later and she's still has no evidence of her tumor.
Well, I've always been a believer in everything happens for a reason. So that has just gotten stronger to believe that. I'm still trying to find out what that reason is.
Who's gonna win? Go Chase!
Colton is now 2.5, Chase about 15 months. They don't know yet what their mother went through, but they do know that she is here, in the now, cherishing every moment.
My husband and I are closer. I play with my kids a lot more. I wake up and I'm like, all right, let's go do stuff. Just in case I don't have tomorrow.
When Amanda crossed the finish line back in June, cancer-free, just 8 weeks after finishing a very different race, this family had no doubt they were watching a miracle.
Had she not had the doctors that were there, and they hadn't diagnosed this as quickly as they had, if they had just started regular cancer treatment, she probably would have been dead in a week.
There's no measure of attitude or of mental toughness, but there's no doubt about it that the will to fight and the will, it helps.
Oh my God, definitely.
Without a doubt.
Definitely. And I told her, God gave you this, second chance in life. Just, you got to do something positive with it.
I don't know if I would say I'm a miracle. I would say the staff and my family are my miracles. Because if it wasn't for my staff and my family and friends, I wouldn't be here. I wouldn't have made it through.
Coming up on Hartford Med.
Her eyes kept closing, her head kept bobbing, and I would say, Jill, and she wasn't responding to me.
A mother of 2, pregnant with her 3rd child, collapses in the emergency department while visiting her husband. How that visit to the ER saved 2 lives. But first, he was on his way to the office to see patients. He never made it. One man's amazing story straight ahead. This is Hartford Med.
I was actually in a road race. I went to accelerate to pass another runner, and I just felt something pull. I actually had a torn meniscus. After the surgery, I could easily throw in the towel and say I'm done. Gave Hartford Healthcare Rehabilitation Network a call. I know my body. I wanted people on the same wavelength as me. Being a runner, it's a different level of being an athlete. They understand it. That's key. They made me stronger than I ever was.
Cooking has always brought this father and daughter together. It is something the 2 have always shared. A morning in the kitchen. It may seem pretty ordinary, but just being here, they'll tell you, is extraordinary.
So the date was February 7th,
and a date that I now refer to as one of the worst days of my life, but also one of the best days of my life.
Charlie Ingardia is an OB/GYN who, for more than 3 decades, specialized in treating high-risk pregnancies. Over the years, he has touched thousands and helped so many through difficult times.
And on Fridays, I see patients in Glastonbury. And since I live in Glastonbury, it makes for an easy sort of commute. And I do remember getting up, and it was early enough, and I said, great. So I got to the gym, and I did some treadmill running, and I arrived at the office at about 8:30.
The office is just 3 miles from home. So when lunch came, he decided to zip home.
And it really wasn't until I backed my car out of the driveway to go back to the office at about 1:45 that I realized that something was wrong.
He thought about calling the office and decided against it. The man who had never been late, not in 30 years, never made it back to work.
1 o'clock came around when our first patient showed up, and I wasn't there. The staff got a little concerned because they know I'm very punctual, and I wasn't there. So when 1:15 came around, they really got worried.
It was just 15 minutes, but his team knew him so well and knew he would never be late.
And I noticed my phone kept buzzing. I picked up the phone, and one of Charlie's colleagues in MFM here said, Charlie didn't go back to work, and we're really worried something's wrong. We're calling the police.
A call that would save his life.
They found him on the side of the road in his car, unconscious. I said, make sure he comes to Hartford Hospital.
When Hartford Hospital's emergency department got the call from crews, the team went into action. Being a gold-certified joint stroke center means there is a rigorous protocol for any suspected bleed on the brain and an expert available 24/7. Time lost is brain lost. Every second matters. Patients are taken immediately to have scans to best determine next steps.
He was slurring his speech. I'm not sure if he recognized me.
Jack Green is the Vice President of Medical Affairs at Hartford Hospital. He came here more than 20 years ago to work for Charlie Ingardia, the man who was first his boss, then his mentor, colleague, and friend.
And the image came up on the screen, and half of the brain was just whited out. And literally, I know I felt my heart stop and my jaw drop, and I knew it wasn't good.
The scans showed the worst. Dr. Charles Ingardia was dying from a massive brain hemorrhage, an arteriovenous malformation, an AVM, or snarled tangle of arteries and veins. It had ruptured inside his brain. Blood was flooding the brain, creating dangerous pressure that could shut off blood supply where it was needed most. That's when the neurosurgeon on call came into play.
Where the AVM was located, right next to his brainstem and other critical structures that were being, compressed to the point where I wouldn't have been surprised if I was about to see someone that was brain dead.
Dr. Brendan Calori.
In this situation, there was this abnormal cluster of blood vessels that essentially exploded inside of Dr. Ingardia's brain and bled into his brain. And the part of the brain that was initially involved, again, it is a temporal lobe. It's kind of behind your right ear. Not a lot of critical functions in that area, on the right side anyways, but it's right next to the brain stem, which is key to life. The basic functions like breathing and moving and being awake. And that structure was being crushed basically by the expanding hematoma, the expanding bleeding.
So he said, if I look at the image, I'd say there's really probably no chance, but I look at him and he's not the same as the image. He's trying to talk, there's something there. He says, I gotta try it.
I've gotten into a lot of trouble in my life for talking and talking too long. And this was a case in which talking actually saved my life.
Dr. Calori would later say this was the first miracle. Someone who was awake and talking when the imaging showed a very different story. They needed consent from family. The closest relative was daughter Emily in Boston.
I had sent him a picture of the homemade ravioli I made because I was all impressed with myself. And he always gets back to me, especially with food pictures, and he didn't respond. So right away I knew that something was wrong. Dr. Green called, and he's like, Emily, it's Dr. Green. Are you on your way? And I said, yes. And he's like, I need to talk to you about a decision. I'm sitting here with the neurosurgeon.
She was driving down at that point. I wanted to reassure her she was in good hands, but also convey to her how critical this situation was, that I wasn't sure that he was going to survive surgery, but I would do everything in my power to save his life. And as soon as that phone call was done, I was racing to the operating room to get the surgery started. I had to open up a small incision in his skin and remove a piece of his skull. And then I was looking at his swollen brain. The anatomy is pretty distorted because of all the pressure. And the first order of business is to make a little bit of room to relieve that pressure. So made a small opening into his brain, and all the blood came roaring out at me, and kind of relieved the immediate danger by taking off that pressure. And then at that point I was dealing with the AVM itself. So an AVM has arteries going directly into veins, and it's very critical when you're addressing them in surgery to shut down the flow into the AVM before you take the flow out of the AVM.
When the surgeon got out of the operating room, he told Emily something that probably just turned everything around. He said, "Your dad's a rock star. He's going to do fine." And that was really the first time my family could breathe all day long, and my associates could breathe all day long. And he was right. He was right.
Recovery didn't happen overnight.
Day after day, little things would get better and better and better.
Long days turned into weeks. But one day, her dad had a special request.
So I'm like, "What can I make you? What can I bring you?" And he said, "German chocolate cupcakes with coconut frosting." And I was like, "Okay, here we go. We're all right." He's just the most super supportive father ever.
There's so many incredible parts of Dr. Engardia's story. The series of events that if they had not happened, had we delayed his treatment even a half hour, he would have died. It made such a difference, those critical moments.
When I said I had angels on my shoulder, I really meant it. I think that there was some sort of divine intervention here.
We treat patients. We don't treat labs, we don't treat x-rays, we don't treat ultrasounds, we treat patients. So you really have to look at the whole patient. Get other data for sure, but the patient is how you make your decision. Human beings are really miracles anyway. And yeah, there's sometimes something in that, I don't know if it's soul or spirit or something.
So when Dad and daughter had the chance to show off how together they make the perfect soft-boiled egg, it was a moment to celebrate.
Perfect.
It definitely makes you look at everything differently.
I think it does change you. I think it's made me realize that we're not guaranteed days, just guaranteed being here at the moment.
Next.
She asked me how dangerous was this, and I said, "You're lucky to be alive."
A woman visiting her husband in the hospital collapses with a life-threatening injury. The decision that would save her life straight ahead. This is Hartford Med.
Cancer divides to conquer, but we'll win by working together in a one-of-a-kind alliance, bringing Connecticut to the front lines of research, discovering new breakthroughs faster, creating one single new standard of care, and a whole new level of confidence for cancer patients. Hartford Healthcare, the charter member of the Memorial Sloan Kettering Cancer Alliance. Together, we'll stay ahead of cancer.
It's my life. I have the 3 girls. It's crazy, it's chaotic, it's my everything.
On any given day in the White-necked family, Emma is probably performing. Olivia hiding, and Jessie Ann is making someone smile.
Probably every day. I have a feeling like that, where I'm just so glad I was here for that.
These are the magical moments of everyday life, made even sweeter because Jillian Whiteneck knows just how close she came to losing it all.
If she would have not have made it, I'd be in a dark place myself, and I think about that now, right? Almost no wife and a 3rd daughter.
May 3rd, 2013. Jillian Whiteneck was home with her daughters when she got the call. A horrible car accident sent Father Jesse to the emergency department at Bacchus. Jesse's brother was killed, a devastating loss, and Jesse seriously injured. He was taken by ambulance to Hartford Hospital. His wife, 7 months pregnant with their 3rd daughter, would go with him. It was a decision that would save 2 lives.
And it was a text message from Jill saying that Jesse was in a severe accident and that He was being transported to Hartford Hospital because of a neck injury, and I just think this can't be real. It just can't be real.
Jill's best friend Heather Main and her fiance raced to Hartford Hospital. They thought they were going to help Jill deal with Jesse's accident, but that was about to change.
When I walked into the room and Jill came to give me a hug and just collapsed to the ground, and I just remember her head and her eyes rolled back in her head. Her eyes kept closing, her head kept bobbing. And I would say, Jill, Jill, and she wasn't responding to me. She was on the ground. I remember her saying she was really hot and that the ground was cold, and she was in the fetal position. So I went to the front desk and I said, my friend, she's pregnant, she's collapsed on the ground, she's not breathing, she's in and out of consciousness, I need help now.
Already in the emergency department, a team rushed over, and within minutes, she was in her own room. But soon she would have to be whisked upstairs to the 6th floor, the area of Hartford Hospital that specializes in labor and delivery. Preliminary testing showed there was internal bleeding, but the most important question remained for mother and for daughter. Where was it coming from?
I just held on to the side of her bed and I went with her, and I remember telling her I wasn't going to leave her.
And it was clear that she had a major problem.
Dr. Fred Rao is an OBGYN and part of a specialized team on call brought in to help.
You know, her blood pressure was low and she was losing a lot of blood, and that's going to decrease the blood flow to the baby.
It could be a uterine rupture, a dangerous complication that can happen in pregnancy.
We did a laparotomy. We opened Jill's abdomen. There was no uterine rupture, but because of the amount of blood, we delivered the baby.
Now, there were 2 patients, both on the edge. The baby, a little girl, born almost 10 weeks early, wasn't breathing, and she was blue.
They told me that they had taken the baby out and that she needed to be resuscitated. Now you're worried about 2 people.
But much like her mom, this little girl would turn out to be a fighter. Inside the OR, the source of the bleeding was the primary concern. The uterus had been ruled out and the baby was safe. But Jill's life was on the line.
Hartford has layers of specialists that are available to manage very difficult clinical circumstances.
Jill's body was losing blood as rapidly as the team was replacing it. Her body's blood supply had to be replaced twice, and the clock was ticking.
For a surgical resident to say there's a lot of blood, like, she got my attention.
Dr. Chike Chikuma was the trauma attending surgeon on call. He arrived just before the baby was delivered.
The way she was being managed is what you would see with someone who had a high-speed or high-velocity penetrating injury, a gunshot wound to a large blood vessel.
And that's exactly how they treated it. In that kind of injury, doctors become detectives, painstakingly examining every organ until they find the source of the bleeding.
They managed her like a trauma patient. You're talking about a level 1 trauma. What that means is somebody that is decompensating rapidly. Those kind of people require multiple teams acting in a synchronized fashion. There are not many level 1 trauma centers, and that's because of that.
They slowed the bleeding with packing to get her blood pressure under control, but still had to identify the source and stop it, or Jill could bleed to death.
I could see where it was bleeding from. It was a pool. It's a large vessel going into her spleen. It was her splenic artery.
Jill had an incredibly rare splenic artery aneurysm, a weak spot on the splenic artery that ruptured.
The spleen is attached in several places to stabilize it, and so you have to take those attachments down, typically to her intestine, to the pancreas, to her diaphragm, and then take the blood vessels. You can do this pretty expeditiously. I think it took us about 7 minutes to get it out. Once we did that, we saw that probably about 90% of the bleeding resolved. That was the moment that you say, okay, from here now, it's up to her.
Not only is a rupture like this rare, it is often deadly. More than 70% of the time, the mother doesn't make it, and only 3% of infants survive.
It was almost a blessing in disguise, if you could say that her husband had the problem he had, if this had happened at home, she would have died.
They had the teams right there to help her. I mean, there's not very many other hospitals that would have that amount of doctors and nurses and blood and everything that she needed, you know, right then and there. Maybe they would have to be on call and you'd have to wait till they got there, and I don't think Jill had that time.
Within a few days, it was clear that Jill and her daughter were out of the woods.
Jill wrote 3 names on a piece of paper because she couldn't talk, and she hid them from everyone. And we took the paper and we brought it down to Jesse, and Jesse looked at him. He circled one, and we didn't look at it. We brought it back up to Jill, and then Jill announced that she has a little baby girl named Jessie Ann.
Did you see this?
Appointments with Dr. Chikuma feel more like visits with an old friend.
My staff cried when she came in. You know, that's why you do it. She asked me how dangerous was this, and I said, you're lucky to be alive. And that is a testament to effort a lot of people put in for you, but also that I think she and her daughter are fighters.
Now I look and I reflect way more than I used to. I took a lot of things for granted. So now when I see him outside or we're traveling somewhere and you know, what I thought would be difficult before, and when they get upset, it's a lot easier, and I'm just thankful for it.
Am I a miracle? I'm told I'm a miracle. Yeah, and I think my doctors are miracles, and her doctors are miracles, because without them, I wouldn't be sitting here, and she wouldn't be sitting here, and my girls, I can't even think about what would happen to my girls.
They are the faces of fighters, patients who arrived on their worst days only to find out it would bring out the very best in them and in all of those around them. Their lives inspire. They are living reminders that each and every day is a gift, and they give us a reason to believe in miracles and to believe in medicine.